Hello and welcome to this channel. My name is Victoria, and in this video we will talk about urinary incontinence in general and also specifically in women. Incontinence is the involuntary passage of either feces or urine, and in this video we will focus on incontinence related to urine. The opposite of incontinence is continence, and this describes the physiological aspect of only passing urine voluntarily and having full bladder control. Urinary incontinence is a symptom rather than a disease and can be caused by different underlying conditions. There are 6 different types of incontinence. The first one is stress incontinence. This means that when there is an increase in abdominal pressure, for example by sneezing, coughing, or lifting heavy items, urine leaks involuntarily. This is usually due to a pelvic floor weakness and the resulting sphincter dysfunction. The next type is the urge incontinence, also called overactive bladder. Here the detrusor muscle of the bladder contracts involuntarily. The patient usually experiences a sudden urge to go to the bathroom together with leakage of urine. This can be due to neurologic disorders or a hypersensitivity of the bladder after an infection. The third type is the overflow incontinence. This type occurs more frequently in patients with diabetes. In this case, either the detrusor muscle does not contract properly, which results in a residual volume of urine after voiding, or there is a urethral blockage, which prevents the bladder from emptying properly. The next type is neurogenic incontinence. This type is due to a disturbed function of the nervous system on the level of either the brain, spinal cord, or distal nerves. This can occur in, for example, multiple sclerosis, Parkinson's disease, or diabetes. One of the parts of the pathway basically tells the bladder to empty spontaneously without the patient intending to do so. The last type is the continuous incontinence. This means that there is a constant leakage of urine without the voluntary decision to do so. This can be seen in case of a vesicovaginal fistula, so a connection between the bladder and the vagina. Here the urine is not contained inside the bladder, and it dribbles out of the vagina whenever it reaches the bladder. It is also possible for several types to occur in the same time. Then we call it a mixed incontinence. After we determine the type of incontinence, we have to grade it based on the severity and the amount of urine that is lost. The mildest type of incontinence is the dribbling incontinence. Here, less than 50 milliliters of urine are lost in each involuntary loss. A grade 1 incontinence is when between 50 and 100 milliliters of urine are lost. Grade 2 incontinence is when between 100 and 250 milliliters are lost, and the most severe grade, grade 3, is when over 250 milliliters of urine are lost. In comparison, for normal voluntary urination, it is normal to pee around 250 to 400 milliliters. Now we talked about the basics of incontinence that apply to both men and women. In the next part, I would like to focus on incontinence in women. I want to do that because around 75 to 80% of patients that experience incontinence are women, and pregnancy and birth make it more likely for patients to develop incontinence. In the next part, I would like to talk about causes for persistent incontinence in women. Pregnancy is one of the causes. The hormonal changes and the weight of the fetus pushing on the bladder can lead to a long-term stress incontinence, so the involuntary loss of urine when, for example, sneezing or coughing. Vaginal delivery of a baby also can cause incontinence. The delivery can weaken the muscles that are needed to control voiding, and birth can damage the supportive tissue and nerves of the bladder. Also, a weak pelvic floor can often be seen in women, which further promotes incontinence. In some cases, the pelvic floor can even prolapse, so drop further down than normal. In this situation, the bladder, uterus, rectum, or small intestine fall further down. This can impair the normal function of the bladder. Age is another risk factor for incontinence. With age, the muscles of the bladder become weaker, and the bladder can't store as much urine anymore. Additionally, involuntary contractions of the bladder muscles become more frequent with increasing age. When a woman comes into menopause, this is usually exacerbated, as in menopause the estrogen levels decrease. Estrogen is responsible for maintaining the lining of the bladder and the urethra, and when the levels decrease, it can cause incontinence. Another risk factor is tumors in the urinary tract and kidney stones. Also, they both become more frequent with increasing age. Both tumors and kidney stones can obstruct the urethra or block parts of the bladder, which can lead to overflow incontinence. What are some risk factors to develop incontinence? As we said, being female increases the risk to develop incontinence. Also, increasing age increases the risk for incontinence. Other risk factors are obesity, as more weight is a burden on the muscles surrounding the bladder. Smoking, neurological diseases, pregnancy, and childbirth also increase the risk. What are complications of urinary incontinence? Urinary incontinence may cause anxiety and worries of leaking urine in public. Patients that are affected may avoid social situations in which they might come into uncomfortable situations. Incontinence also leads to the skin of the perineum being potentially wet for longer periods of time, which can cause a rash and skin infections. Also, urinary tract infections are more common with incontinence. How can incontinence be avoided or treated? There are some foods that can stimulate the bladder and some foods that stimulate the urine production. Those should be avoided and include alcohol, caffeine, carbonated drinks, chocolate, spicy and acidic food, and artificial sweeteners. Also, a healthy weight and to quit smoking can help to prevent the development of urinary incontinence. For women also, Kegel exercises are recommended. They help to strengthen the pelvic floor and so prevent pelvic prolapse, and they help to prevent incontinence before it occurs, but also to reduce it when already developed. That's it for this video. I hope it was helpful, and if you like our channel, please subscribe. Thank you for watching and hopefully see you again in the next video.